So we've got a brilliant session coming up. Really looking forward to this. Looking at sort of women in healthcare data science, and joined by an absolutely fantastic panel. The panel will be introduced in a minute by our chairs, Rose and Clare, both clinical academics who are simultaneously doing PhDs in data science. But I think this event's really important because, as I think colleagues know, we are really trying to move healthcare into the data-intensive era. And hitherto, really, I think this field has been largely dominated by males. I think in Edinburgh we are making progress on this front, but we've got a long way to go. And hence, this panel discussion is really important. I'm really looking forward to the insights that colleagues have. The format of the event is that we will have a facilitating panel discussion. There will be plenty of opportunity for colleagues to contribute. But we're doing this through you contributing online. And so what you need to do is log on using this QR code. And what I'd be grateful for you to just check that you can make this work. And if there's any problems, there are colleagues that will go around and help you in that respect. Wi-Fi should be working here, but if there are any problems, please do let us know. Colleagues online can also contribute in the same mechanism using our Usher Institute website for this event. There are no planned fire alarms, so if there is a fire alarm, please just do make your way through the exits at the back. But I think without further ado, Rose, I'm going to hand over to you. So thank you so much to you and Clare for facilitating this.
Thank you, Aziz.
Do you need this?
So I unfortunately have my own mic, I think, so I don't need the special mic, but I'll put it here as our panelists will need it later on. So thank you very much for the introduction. As Aziz says, I'm Dr. Rose Penfold. I'm a doctor specialising in geriatric medicine and currently undertaking a data-driven PhD here at the Usher Institute in the University of Edinburgh. Very excited to co-facilitate this panel today. It brings together two things I'm very passionate about, which is using health data to improve the health of people in the population, and also increasing opportunities for women working in health data science in its broadest sense. So really excited to be here today and to see so many of you here. And going to be co-facilitating this along with my friend and colleague, Dr. Clare MacRae, who I'll allow to introduce herself.
Hi there, good afternoon. Thank you so much to everyone who's come in person and online, and thank you very much to Professor Sheikh for the introduction. So I'm Clare MacRae, I'm a GP, I work here in Edinburgh, and I'm in the second year of my PhD, and I'm an MRC Clinical Research Training Fellow and work at the Advanced Care Research Centre, which is part of the Usher Institute, and work primarily with data and become increasingly enthusiastic about that as time goes by. And we're really excited about the fantastic speakers that we have with us. So we thought to begin with, we would just do a little bit of an introduction and a reflection on how everybody's kind of got involved in their career in data science. So first of all, we've got Professor Julie Jacko, who's recently joined us from Florida, and we're absolutely delighted that she's here. And she is the co-head of the Center for Medical Informatics, and she's a chair of Health Informatics and Data Science. So, Julie, could you tell us a little bit about your journey and how you ended up in the role that you're in just now? Thank you.
I'm delighted to, thank you, and it's such a privilege to be here and be on this panel. This is week 4 for me in Edinburgh. Week
Welcome.
4. Yeah. I moved here from Miami, Florida, and I am absolutely delighted to be here. And I'll just say a little bit about how I became involved in the domain of informatics and data science. I am an industrial and systems engineer by training, and I'm going to plug Purdue University, a 3-degree Boilermaker. And as an industrial and systems engineer, I have a foundation in complex my industrial and systems engineering expertise via work in data science and informatics, that I could have an impact, and that mattered to me. And I wanted it to be a meaningful impact, improving people's lives, helping them live happier and healthier. And that really mattered to me. I was asked if my younger self would have been surprised to learn what I'm doing today. And I think my response would be no. I had the privilege of a father who was a civil engineer, a professor of civil engineering, and his expertise is air pollution control. And I witnessed his work and the way that he conducted research as an academic and also consulting as an industrial consultant, with the ultimate objective to improve air quality for the health of people around the world. So he's been an inspiration for me, and I think because of that, my younger self would not have been surprised by what I'm doing. And with that,
Thank you very much, Julie, that was fantastic. And our second panelist is Dr. Riinu Pius, and she's a senior data manager at the Centre for Data Informatics and a guru in R that we all are very grateful for her input in the fantastic course and book she's done. So do you want to tell us a bit about your journey, Riinu?
Quite a while longer than 4 weeks. Definitely surprised to be speaking at like childhood me would have been surprised to be speaking at an academic event. So I was supposed to go to university with my family, and I studied physics. I then did a PhD in air pollution modeling. We're not related. But I wasn't looking at health effects of air pollution, looking at other interactions, and I was doing it computationally. So what happens? My dispersion into healthcare data science was a lot less conscious than Julie's, for example. I was looking for a job, and the postdoc jobs in air pollution tended to be 1 or 2 year contracts, and I just wasn't feeling like moving to yet another city or country for a 1 year job. So I got a local job at the university as a data manager in medical data, and I've never looked back. That was over 7 years ago. I can hardly imagine doing anything other than healthcare research, because it's just so wide ranging. It's complex, as been said. It's so challenging. Yeah, I love it.
Wonderful. Thank you very much, Riinu. And our final panelist, we're really delighted to have Dr. Charlotte Lee-Sinclair come to visit us. She works and lives down in London, so we're really, really lucky to have her here. And she is the head of commercial at Limbic. And Limbic is an AI mental health company and has had great impact throughout the UK. So thank you very much. Do you want to introduce yourself?
Thank you so much for having me. I guess I'm here because I speak 3 languages. So I speak medicine. I started off life as a doctor. Hands up, do we have any doctors here? Any medics? Nice. It's up to you guys. And also on the screen as well. I also speak consulting. So quote unquote, I moved to the dark side about 8 years ago and became a management consultant, learned about business, how to sell, how to implement large-scale healthcare transformation through the lens of industry. And over the past, like 4 or 5 years now, I've been working at an interface between digital health and the NHS. So my first job just outside of consulting was in big health. And I don't know if anyone has heard of Sleepio. Yep. Sleepio was my baby. I looked after Sleepio for 3 years. I led the UK team. At the end of those 3 years, we got national reimbursement in Scotland. So essentially, NHS Scotland fronted up a sizable chunk of money to make sure that Sleepio was available across the whole population of Scotland. So that's 5.5 million people. So the recovery rates of those who are suffering from insomnia and poor sleep. And then following on from that, we managed to get 90 recommendations. So that's the National Institute of Clinical Medicine, where the pathway was updated. So this was the first ever digital therapeutic and app that automated. You okay? Want some water? was the first ever digital app that automated CBT for insomnia to be recommended as a clinical treatment and guidance. So that was pretty big for the little old me. And so I sort of take a little bit of that world where I try to translate all this great evidence and data science that we've had into the world of the commercial reality of trying to make this thing work within the NHS context into Limbic. So more about that later.
Wow. And unfortunately, we are going to also be joined by Kirsty Ward today, who's the National Clinical Coordinator for the Scottish Hip Fracture Audit, working with Public Health Scotland. But unfortunately, she's unwell and unable to join us today, but she has a nursing background and is very passionate about increasing opportunities for frontline healthcare professionals and nurses to come into data science. So we're very sad that she can't join us today. And I think hearing all of you speak in your introductions, I think it really strikes me as just kind of the diversity of pathways by which you've come into health data science. And I guess it's sort of difficult to answer this in a sort of single sentence or in a single conversation, but if you're thinking about sort of building the pipeline of future health data scientists, how should we be training our health data scientists for the future? I think you probably all speak to that, but Riinu, do you want to take us off?
It's important for the teacher or trainer to remember that they are not the students. And what I mean by that, health data science teams include really technical people, data engineers, data analysts, data scientists who spend most of their time writing code. And these teams also include a lot of people who work on everything from project management to communications, governance. And I feel like there are more training courses currently provided for the first half, so there are more kind of technical and programming courses, and where there are lots of people who would like to learn just a bit more about how maybe programs work, what do I mean when I say run this script? You know, most people in this room will probably know, but everyone would want to know what running the script means, I assume. And so I would, so my kind of immediate goal would be to increase the diversity of the range of courses within data science training.
Okay. Yeah, and better advertisement for the University of Edinburgh as well.
Yeah.
Yeah.
I'll just build on Riinu's statement, because I agree wholeheartedly with that. And as an academic who's built academic programs in this area, I think we do ourselves a disservice if we focus exclusively on building technical skills that are needed to construct the systems that we are ultimately going to implement at point of care or wherever they need to be implemented. If we don't also integrate psychosocial factors, an understanding of those, an understanding of the social determinants of health. And I'm giving a shout out to our colleagues who are social scientists, and psychologists, and economists, because not only do we have a responsibility to build these systems robustly so that they improve effectiveness and efficiency, but we also have to figure out how to bend this cost curve in healthcare. And we have to be sure the systems we're developing are actually usable by the people they're designed for. So I agree wholeheartedly, and I believe when we design these training programs, we really must have involvement of our colleagues across the system.
Oh gosh, last but not least, I found this question extremely difficult to answer because I came from a very, very different background to these women here. I really learned data science organically. And by organically, I mean 1 or 2 workshops or PBL workshops in med school where we had to go through papers and learn about statistics, and whether or not that really stuck beyond just, you know, doing the exam is a very good question. But I also had to learn data science through the sheer need to be able to produce deliverables in my management consulting career. I remember the first project I was on, I was given multiple data sources in a hospital. I was stuck in a little back corner office behind A&E. I could hear people screaming outside whilst I was trying to work through my Excel spreadsheet and create some kind of modeling to work out whether we had, you know, undue variability in our surgical outcomes based on, you know, the surgeries that we had, the time and the outcome data. that we had. And I just had to muddle through, honestly, and it took me 2.5 years to try and learn exactly how to do this sort of stuff. And that's, the brutal reality sometimes of some of these career pathways there. Learn it as you go. And trust me, I tried hard. It was challenging. I tried Python, my God, that was hard. SQL, still can't do it. So now in my role where I lead growth teams and commercial teams, I rely on super smart data scientists like all of you to be able to come up with the analyses that I need for marketing, pricing, trying to influence government and policy to try and put more funding towards digital health, to work out how to resource internally. So data science is, I guess, my lesson learned is, a common language across many different industries that intersect for healthcare.
Thank you very much. Really, really interesting answers there. And I think we're going to build on those as we go through the rest of the questions. So I think one of the key themes here is working across different settings. And I really like what you said, Charlotte, about speaking these different languages. And I think there's different it's a different kind of work culture in the clinical setting and policy setting and data science setting and academic settings, and being able to bridge those and kind of and be able to be conversant in those is really, really important. And again, I think one of the biggest things that we want to talk about today and bring out is impact, because why are we here? Why are we doing this? So the next question is, what challenges do we face and how can we work effectively across frontline healthcare, academia, policy, and industry, really to make that impact happen? And Julie, I wondered if you could maybe answer that question first off, please.
So often I'm asked questions about infrastructure. So what can we do from an infrastructure perspective to enable that to happen, that cross-disciplinary pollination happen more effectively? And my response is, it is no longer the case, for the most part, it is no longer the case that we are addled by technical challenges of data exchange across organizations or disciplines or sectors. Those technical challenges are largely overcome or can be overcome. The real challenges, I think, that hold us back, the real obstacles, are obstacles around data governance. They're obstacles around willingness to data share, so territorialism about data, right? And I believe that is where we need to invest time and money and deeper understanding, because if we can't get our policy and willingness aligned with the premise of shared data models, then we will not accomplish what is possible to accomplish as data scientists, informaticists, and engineers. I cannot tell you how many boardrooms I've been in where the big elephant in the room was data governance and our ability to overcome that obstacle to be able to cross disciplinary and organizational boundaries.
That's really, really interesting, Julie. Thank you very much. I think we're going to ask Charlotte. You've had this experience of this this app that's been really widely taken up. Could you just tell us a little bit about that and what it was like, kind of out with your various different hats on and making that come to fruition?
At this point, I'm going to get to my notes.
Yeah. All right, we've got a long time, so yeah.
Okay, so. Apologies, I'm 34, so I groan sometimes when I lean across stuff. So let me start off with, does everyone know what CPO is? I gave a bit of a brief intro. Okay, so it's a digital therapeutic for treating insomnia. So what do I mean by that? Historically, CBT for insomnia would be delivered by nurses, GPs, psychologists in a community setting, if at all. It takes about 6 weeks, and it's much like any other CBT program. That therapeutic alliance is really important, but there's also a crucial bit around sleep restriction around session 3, which is quite challenging to adhere to. So one of the things that our co-founders did, so Colin Esty, who was a professor of food medicine at the University of Glasgow at the time, and still is, I believe, tried to do was try and scale community from this. We tried to do it first by writing a book to teach people to apply some of these evidence-based techniques to themselves. And then he met a guy called Peter Hayes, who previously was at Saatchi & Saatchi. So you can imagine what kind of guy he was. Really great at marketing, really great at PR and storytelling. Those two, with some incredible designers, created this program called Sleepio, where literally a digital Scottish box will take you through the program. And we were able to go through RCT research with a 70% recovery rate. We had 13 RCT, which was a little bit over. And I told you a little bit about the outcome. So the story ends with a positive NICE recommendation in Scottish National Reimbursement. So how did we get there? So we started off with an RCT. And I know that really you've probably got opinions around RCT being supposed to be evaluating products like this, but that's what we did, because that was the most, that was the gold standard evidence at the time. We used that data, which was the strongest, to convince frontline clinicians to use it. We used that data to share outcomes, like real world outcomes of how their patients were using it, and whether they were recovering. And this, remember this feedback needs to be never happened in medicine. You prescribe something, it's a bit of a black box, and you're like, what was it, like a third take it, a third don't, a third we have no idea what happened. Yeah. That's completely not evidence. By the way, that's just people one day. And this feedback loop, I guess, created momentum to get more clinicians to use it because they thought it was helpful. And to cut a long story short, we used that real world data. It's a very large scale, 18-month observational study, to inform a health economic study to show that it was cost effective. And that was the thing that formed the basis of our pricing. So even today, in the world that I live in, which is money, revenue, pricing, unit economics, right? LTV to CAC ratio. Like that is not too far away from the world of data science and academia, where I rely on the great kind of academic papers and publications that you guys will be able to create to be able to then inform all of my marketing and pricing decision making. So when we approached NHS Scotland just as we start, we already had an extremely strong evidence base. And the fact that the great government at NHS Scotland understood the importance of this data and understood the strength of that data, then propelled, essentially a 258-day negotiation process to get it nationally reimbursed, which is another story.
That's really, really interesting. And I really like what you said. You're using the real world data to kind of re-inform the design and to prove that it works. I think that's a really interesting concept. Thank you very much. And Riinu, do you want to tell us a little bit about working across sectors? Does that come into what you do? Because obviously you're running these incredibly impactful training programs. Do you get people from different backgrounds that come along to these courses? Do you feel that you have multiple roles in that?
And Riinu, feel free to comment on is an RCT the best trial design for a Sleepio app? That's really testing it in a different way. Okay.
Yeah, 3 questions. We the training I've done definitely mostly attracts people from academia as well as the public sector. We have had a little bit of kind of private sector penetration as well, and I think that is building the kind of private sector collaboration as well. We have had slight issues with so you mentioned governance and kind of data access, and you mentioned kind of the private sector and the academia working together to provide relevant evidence.
Yeah.
And we have come across issues with governance. Say, oh, we will prove a study if it's definite, it doesn't have a commercial output. It might. So that's an issue we come across. RCTs, I'm not going to get into RCTs versus observational studies, but long story short, they're both necessary. You can't just have one or the other.
Yeah.
Yes, thank you.
Oh, thank you, Riinu. And I guess, see, thinking about the opportunities that you've had, which some of which have been in more formal training, and others have been perhaps, I don't know, more opportunistic, or opportunities that have come your way. Guess sort of how do we create opportunities for people in this room, for future health data scientists who want to pursue the kind of careers that you have all pursued so far? How do we build those opportunities, and perhaps what barriers do you see to doing that? Yeah.
Quite a few different things here. I'll start with just one, and so others will fill in on the others. The field is changing quite quickly. I mean, both the technical aspects as well as the governance processes, the I don't know, data sharing agreement, all of that. And as someone who's recently been away from work on maternity leave more than once, I do feel like you come back and the world's changed. And the technology's changed, and that's actually, I'm not saying I find it scary, but I do find it slightly disorienting. But there's a positive in here. Wait for it. I feel like the fact that it's always changing makes it possible for new people from other fields, people looking for field changes, to get back in there, because us seasoned scientists, us seasoned professionals are still having to relearn and reskill and retool. Retooling is the word I learned recently. We're retooling constantly, which means that if you're thinking about entering this field as a, from different fields, you could retool with us. And I think that's definitely an opportunity here.
Yeah. Can you explain a bit more about the retooling, Riinu? So it's not something that I've come across before. Reskilling and retraining are things that I've heard about, but just tell us a bit more about retooling. What do you mean by that?
Retooling is just a more technical word for reskilling, because the skills are like transferable, whereas retooling is you have to learn either a new programming language, or a new package, or an extension to a programming language, a new database structure, stuff like that. But it's not just about databases, it's about reports, it's about interactive charts, it's about explaining them to various audiences. So that's retooling, not just for programmers, but also retooling for all of the communications and the program management people. Everyone in data science is always retooling.
I like that. I'll be using that moving forward. Yeah. And I guess Charlotte or Julie, do you have anything to add to that in terms of how we create opportunities? And
Well, I might be hiring soon. No, I'm not. I'm stop playing Limbic. But I think with the opportunity side, so particularly in my world, I'm speaking from the perspective of a medic who's become an entrepreneur, essentially. But just do it. Just do it. Foster a growth mindset. Realize that you won't be able to know everything all the time. You'll be learning every day. You'll need to have humility and faith to be able to get through this. And to make sure that when you get to that point, you hire lots of data scientists to support you along the way. But honestly, it's about gumption. It's about taking the risk. It's about humility and the growth mindset to be able to then surmount any of those challenges and to organically grow into any role that you need to. So yeah, again, data science is a constant language that is used across all of health tech, and regardless of where you end up, it's going to be helpful.
And Charlotte, you mentioned a couple of times about how you sort of work with data scientists. Sorry, Julie. How you work with data scientists. How did you meet these? How did you meet the people you work with? How did you begin to work together? Could you tell us a bit more about sort of that initial stages?
Yeah, so data scientists exist in almost every part of the business. So I will have data scientists who may work in the finance department, who may work in the marketing department, who obviously work in clinical research or clinical product management, because but the way that they use data science is going to be different. So the clinical product managers are out speaking to our users, speaking to clinicians, gathering that data and trying to work through any kind of data to work out whether this product is working or not. Are the features actually delivering value? And how do we then change those features to deliver yet more value? And then the clinical researchers will be doing a more academic role where they'll be finding academic collaboration, seeing if the product makes a difference on at scale, so kind of like clinical product management, but on a much larger population. And finance, the data analytics team will be looking at, well, are we as a company delivering on our mission? So what are the KPIs that we're looking at? Number of users, the number of clinicians that are using it, the outcomes that we're seeing in the real world on an ongoing basis for our internal board report. So just to illustrate that point, really, like they're trying to do everywhere, and it's useful multitude of reasons.
And yet, for women in data science, it is the road less traveled, right? 15%, 15% of data scientists are women. And those numbers have really not improved despite efforts to improve them. So it's an appalling lack of diversity in a discipline where there's absolutely no reason. Other than we have a STEM funnel that begins in elementary school, and we lose women out of that funnel across the spectrum from elementary, early education, all the way to folks in occupation as adults who abandon the field. And I think that there are a number of reasons for that. I think that we don't do a good job, those of us who are in the discipline, or advising those who wish to be in the discipline occupationally, we don't do a good job of connecting the dots between what it means to be a data scientist or informaticist and having impact in the world. That's what's so interesting about many of Charlotte's statements, is that she's speaking about products that have real impact in people's lives. We can do a better job of connecting the dots on that for people, because I think that many of us really wish to work in an occupation where we're making a difference, where there's meaning, where we know that we're helping to change lives and improve lives. And data show that many women who are making the decision about studying or not studying data science aren't connecting the dots on that. They don't see it. And they also worry about workplace culture. That's another thing that the data show women worry a lot about. So we need to do a better job in all of those areas. And I think it's incumbent upon those of us who are working in those areas or training people to work in these areas that we improve those statistics within the workforce.
And I guess sort of following on from that, how can we begin to help people to connect the dots? What can we do to try and empower women and make women feel able to access and access these careers in health data science and do the kind of things that you're all doing now?
Well, events like this.
Yeah.
And those models, I think, can go a long way in helping community people about the role of women in data science. But I also think that we need to really rethink mentorship. Whether we're talking about mentorship within a corporate environment or mentorship within the academic environment, we are not doing mentorship well. And I think that that's we could do a whole panel on mentorship.
Yeah.
But I think where we fall short is that we can do a better job enabling and championing and helping women become all that they can become in this field. And we need to rethink the way to do that.
I think Charlotte, you had something to add to that.
Amen. I can count on one the number of women who have reached out to me on LinkedIn. LinkedIn is like the social media for business. The only social media that I use for my things. But that is shocking. I've been on LinkedIn for many years. I have a couple thousand followers. And you would have thought that as an Asian woman speaking publicly on a forum like that I would get more women in my DM, frankly, like saying, hey girl, I'm just wondering, want to get a job with you or internship, or can you just give me some advice around how to navigate this tricky workplace like situation with my boss or whatever. No, zero, completely cut. Where are you? Honestly, I don't think that you've all got it down. Otherwise, we have a much better statistics for women in data science. And by the way, I don't know this necessarily data science, but certainly my role in leadership requires me to be able to look at data effectively. There was a study released in May this year showing that female leaders of Fortune 500 businesses had better outcomes, i.e. made more money for that business than their male counterparts. So I'm just saying, like, reach out. Like, where are you?
Yeah. And do you have anything to add to that, Riinu? Specifically about kind of how we increase opportunities, how we make people feel enabled to do careers in health data science?
Maybe I would like to circle back to a very dramatic issue, which is contract length. And I want to talk about it in length, but I will mention that it will be harder for someone with, say, caring responsibilities to accept a short contract than it would be for a young single man who can maybe risk not having that job for a couple of months in a year's time. And that just makes it less inclusive and less attractive for people to try and change careers or even change fields within kind of a familiar career. So that would I would actually help diversity if contracts were somehow long. I don't know how. I bet you only hire permanent contracts.
Yeah.
I'll apply later.
Yeah. No, I think it's really important, Riinu, and you're right to discuss some of the kind of practical aspects and challenges that women still face in the workplace. I think it's very timely having this panel discussion this week, because we were talking about just before we were talking about Claudia Golden's work, winning the Nobel Prize for Economics, her work related to the gender pay gap and factors that are associated with that and factors which allow that to persist. And in listening to a podcast about it yesterday, but they spoke there a lot about this idea of the care penalty and the fact that women often still take the majority of care responsibilities, be that children or caring for unwell patients, or there's more domestic responsibilities in the home. And all of those things seem to, or at least are associated with, data scientists here, so I won't suggest causality, but associated with a widening of the gender pay gap between men and women. So I think it's right to talk about things like that, and also to think about things that we can fix as well. And thinking about things like contract length is something that we should identify as an issue, and that we should try to fix as well. Yes, did anyone else have any thoughts on other issues that we can fix to make things better and to try and improve things for women coming into data science?
Well, I guess speaking from the perspective of someone who's in a very unique position where I get to design the policies that define our organization, I do see it as my responsibility to ensure that my company, Limbic, is not just friendly to women, but empowering for them. That there is a career ladder that they can clearly understand where they are and where they need to get to. That there is a maternity leave policy or parental leave policy that is inclusive, that is extremely competitive, that supports women post-birth, not just, on the peri-birth side. That's super important too. Ensuring that we have great mental health support, ensuring that we have work-life balance that can support women with families, not just women, but also men, and also push the fact that, women and men can be in leadership positions and completely kill it, despite, their gender. So that's a few of the things that I am personally taking on as actually the only woman and in the senior leadership team at Limbic. So it is hard, I'm not going to lie, but I'm just bolstered by the fact that there are so many of you in the room today, and if I can at least notify a few of you moving to this space, then I think that's a job well done. But I'll stop waffling now.
Not at all. Thank you, Charlotte. And yeah, I really hope that this event and hearing from our speakers today will encourage lots of you to continue to pursue careers in health data science. I think we can see here this the breadth of opportunities that are available, as well as the very different pathways that people have taken. I think, Julie, do you have something to add?
I think Charlotte's point also speaks to the importance of being selected when you choose a workplace. And as I was listening to her speak, I was thinking about the fact that because there are 15% of you, you are so valuable to the workforce. And you can afford to be selected and to look carefully at those who are employing data scientists and the importance of company policy. When, and we've come a long way, but I can tell you a little story. Riinu was speaking of maternity leave, and it brought me back to 2004 when I had my son. The institution I worked for did not have maternity leave at that time. I gave birth on a Tuesday, and I was back at my desk on a Thursday because I was terrified of being looked at as though I was out of the game, right? If I took time off. Those circumstances have changed in most cases, but it goes to the importance of choosing your workplace carefully. Look at the policies that are in place. Make sure that they align with your values and the life that you want to live. And thankfully, there are people like Charlotte who are now in a position to make policy. And it matters. It really affects one's ability to live the life you want to live as the professional you want to be.
Thank you, Julie. So I think we want to make sure there's lots of times for questions. So please continue to submit those on Slido and everyone online as well. So I think probably just finish with one question for all of you, which is, what would you say to anyone in this room or in the virtual room online wanting to pursue a career in health data science?
You can do this.
Yeah.
And I'll briefly explain. It is baffling how many times in my life people have told me straight to my face, you can't do this. Why are you working on this project? Why are you taking up this PhD program? You can't do this. Why men and women go around telling other people they can't do this? I don't understand, but ignore them. Ignore them, you can do that.
Thank you, Riinu. Thank you. Yeah.
I can put it better myself, apart from perhaps adding exclusive. And also, to each point, we definitely, if you're moving into industry, choose companies that are like the values. Really important. One thing I think makes a big difference in your work-life balance and your well-being.
I would say, number one, choose the program you study carefully. Ensure that it incorporates not just the technical, analytical aspects of what you need to learn, but also, as I mentioned, a well-rounded perspective on sociology, psychology, economics, so that you're sure that when you go out, you can have an impact. Secondly, choose your mentors selectively. Make sure that the mentor you choose is going to truly champion you and enable you, plug you into things that would enable you and empower you. And thirdly, choose your employer intentionally. Those are my 3 pieces of it.
Well, thank you very much, Julie. I think we've heard some fascinating insights and real diversity of experiences from our 3 panelists here today. Hopefully you've all got some questions for them. So I think now we're going to move into got about half an hour or so for questions from you and from everybody online. So please continue to submit those via Slido. And I think Clare is going to start with our first question for the panel.
Thanks very much. You've got a really healthy collection of questions already. So I'm just going to go chronologically. And the first question we had was, Do you think there's still reluctance to engage with commercialization and translation? Like you were saying, we know some of the organizations you worked with, they didn't want that to be the case. And do you think that reluctance might hold back women?
My issue specifically was like the governance documents, and that said that if commercialization is on the table, you need to fill in 200 more documents instead of 100 documents. But Charlotte,
This is a tricky question. Well, this is related to commercializing academics, right? So there's a number of infrastructure challenges where, particularly, I would say certain universities, I'm not going to name them, will take an extremely large cut from the get-go. And from that moment, your company is pretty much dead. So that's a bureaucratic process, and if you can't really build products and move in an agile way when you're being funded by a large academic institution that's expecting a return, they don't really operate like true angel investors at that stage. And there's a number of examples of this causing some startups with extremely great academic research with huge commercialization opportunities that fail at the first hurdle. And usually it comes up first being an investment round or whatever Series A. But does that, I guess, such a second point, like does the lack of commercialization intent turn off women? Is that the question? So, well, I guess it's the woman in me. Yeah. That's the outcome. So win-win. So I think in terms of actually making a real world impact, getting it into the hands of people and then transaction as a result of it is a huge part of it. So I certainly think that it's a big impact on people in general, and the viability of that part, but whether that's specific to women or not, I don't think.
And a question sort of probably for Julie and for Charlotte, actually. Someone said, Charlotte, you mentioned using LinkedIn as a platform for connecting with other women in the field. So firstly, how does someone initiate that conversation via LinkedIn to connect with you? And then perhaps Julie, could you speak a bit more about how can we find someone to mentor us? How can we seek mentors that are going to actually help us further our careers?
There's a direct message. Navigate to the top, like a little box with a thingy at the bottom, and then you click on it, and then you type my name, and say, "Oh, I would like to connect." And usually have about 300 characters or so to introduce yourself, and then I usually accept, and then ta-da, you get to be mentored by me. No, so it's like, not trying to be patronizing or anything. Honestly, it's just don't overthink it. It can literally be 4 words. Like, "Hi, I need help," or I'm wonderful help. I'm not really good at like a brief intro to yourself, like what it is that you'd like to get from me. And I would just be honest, if I can't help you, I will try and navigate the right person as I can. I'll give you my time. Particularly if you're a woman, because it's so hard. I remember doing it when I was young. And it was like a shotgun approach. It was for every 20 people I approached, I would only ever get one person to respond to me. So you just have to keep going.
On the topic of mentorship and how you find a mentor, I have seen countless top-down mandated mentorship programs fail. I genuinely believe that bottom-up works better, and that puts the onus on all of you, as Charlotte just put the onus on you. Meaning, when you're in the workplace or you're in your academic program, observe the people around you who have more experience, who have been there a while, who know the system or know the programs, or are at a level above you in the organization, observe which ones exemplify the values that you wish to have, that you value, and observe those that seem generous with their time, generous with their expertise, and demonstrate a willingness, as she has, to help. And develop a relationship with that person. Go, cold call that person. Set up a meeting with that person, or happen to run into that person in the hallway, orchestrate something where you can be very straightforward with them and say, I am looking to accomplish X. Could I talk more with you about that? Initiate the conversation and have the ability to swallow your pride to do so, and have the ability to humble yourself to have that conversation. And I guarantee you that the vast majority of people that you approach are going to be delighted to spend time with you and share what they know and help pave the way for you. The key thing is choice, and sometimes you don't make the right choice in a mentor, and that's okay. That's okay. Don't view that as a failure. View that as a learning experience. And then go back to your observation. Keep watching people. Look at those you wish to aspire to be like, and then have the guts to approach them. Oftentimes, someone becomes a mentor, and the word mentor is never used, right? You're in a relationship with someone who is generous with their time and what they know. And that those types of mentorships I have seen work the best.
That's really interesting. And yeah, I think mentorship is so impactful, and reaching out to the right person, just looking for that person that you think, I'm really inspired by you. I think that just works so well. I've had a fantastic mentorship relationship, and it was exactly like that. It's wonderful. So we've got just so many fantastic questions, and it's going to be a bit difficult to choose them because they're all so good. But I really like this one. We've got a question. Sometimes it feels hard to know which skills, knowledge, and tools are needed to push forward in data science, and actually how can we approach this, and how can that be easier for women? And I think my experience, I first really understood data science about 4 years ago, and someone mentioned Python and Anaconda, and I was like, there's snakes, and then it sort of gradually fit, and there's something others in Excel. It's just crazy, mind blowing. And just all these kind of technical terms, and it just felt like this is a whole world, and I don't belong, like I don't know. And then you get into it, and then you do feel you belong in there. But I just wonder where the space actually, maybe women have slightly different skills. I don't know, maybe not, but how can that sometimes be easier for women to break into that, to learn skills, to develop these expertise?
I'll start. Start with the task, not the tool. So pick something you're actually interested in, and this may be, I once learned a new way to program when I was making my wedding invites in a programming language. To go with that, and that made me learn new things because I hadn't facilitated wedding invites. But if I had thought, oh, I want to learn this tool, and I'm going to start applying what an example data set downloaded off the internet that doesn't actually relate to a specific problem I'm trying to solve, that's a much harder way to learn something. So start with a pick a task, and then try and pick a tool, and it doesn't have to be the best tool for the job. Just, that's the way to learn a new tool with a task.
That's fine, because I think there's some even more challenging questions to come. So I think something that someone's asked here is about, and we haven't really talked about it much today, but actually, should men and could men be better allies working for women in data science? Now, I think looking at this room, we can see we have a large majority of women in the room, but I think it's really important that we're engaging men in this conversation as well. So I think we'd value your thoughts on how we can engage men and what men can be doing to help push forward things for women in data science.
I'm happy to say that some of my best mentors, the most transformative people in my life have been men. And I think that male colleagues and male mentors have been absolutely instrumental in my career progression. And so, and I believe that the vast majority of men that I've encountered are very much aware of women in the workplace and delighted to have women in the workplace. I think that there are systems in place and structures in place that were built for men originally, and that all of us working together to make changes to those systems and structures will enable everyone to be more successful. And that's how I think.
I think it reminds me a little bit of Paris and stuff. If anyone's ever read it, where the problem is that buses are used by women. We have prams, and buses aren't designed for prams, but it's never going to be sold because men design the buses, never use the buses. Because they have private chauffeurs in their own Mercedes Benz to go to to work. And so there is a huge part here around, and big up the men in the room. Just be aware of how society is structured and how these processes have been put in place that favor men over women. And if you are in a position to change that, do. And I think there's a few other points around. I would agree with Julie in that some of the biggest allies in my life have been men who have had 45 years, 50 years of experience in the industry. One example is that yesterday I was at the Labour Party conference, and I was speaking about the role of mental health and the cost of living crisis, and how we should be working in communities and charities, like joining up services, trying to support those, and influence policy in a potential Labour government. Not being too, not being,
yeah.
And it was the first ever roundtable I had ever done. I was surrounded by the CEOs of Minds, Mental Health Matters, Rethink, Systems Advice Bureau. There were these amazing think tanks, super smart people in the room, and there was this little old me representing digital mental health, and this newcomer, we can do stuff too. And there was a guy who was CEO of the NHS conference, and he said, he is super well known in the industry. He speaks to the Prime Minister almost a weekly basis about his stuff. And he just kept looking at me as whenever there was a point that potentially digital health, could be made, and he's like, come on, it's your turn to do stuff. And he kept looking at me and mentioning me by name and mentioning my company. I was like, oh God, you really could have just totally ignored me and pushed your own point of view, because that's most of what they believe in round tables. But I just thought that was a wonderful example of how men can be allies. So definitely do more of that.
That's amazing, Charlotte. Thank you for sharing that. Yeah.
Thank you very much. So a slightly different topic. One of the questions has come in about data territorialism, and that's one of the kind of barriers to moving forward with data science. I think that's really interesting. So the question is saying, in developing countries where data science seems to be in its infancy, a major issue is often extreme territorialism over health data. How can we approach this? And I think that is also an issue that we're experiencing here as well. And I was just pulling right back to the beginning of the discussion, Julie, when you were talking about that's one of the major barriers we have, is the kind of, we don't have necessarily technical challenges, but we have issues with data governance and willingness to data share. What are some of the solutions to this? I mean, I know that that's a really big open question, but can we think of some of the themes or some of the approaches that might help from an academic point of view?
I think that the solution lies at an intersection of data science and law. in those conversations with data governance. And territorialism is something different. I'll get to that in a moment. But on the topic of data governance, very often it's the lawyers in the room who are creating the obstacles. And so I think that we need to work differently and smarter with our legal teams. And this is not to knock lawyers. I'm a huge advocate. But I think that sometimes they don't understand what we're trying to accomplish with data and are so focused on the legal element that if we were communicating better, if we could find a common language, then we could be more successful working through some of these challenges. It's not that governance isn't important, it's that it should not hinder us, it should not slow us down. With respect to territorialism, I see this more in corporatized healthcare. That is in particular where I've witnessed it most prevalently. The desire to hold on to and not share data that might actually, if released and shared in the right communities of academics, we may be able to answer some of our grand challenges. We may be able to address some of those grand challenges. And I think that is a very big culture issue that must be overcome. And the best way to overcome it is to demonstrate the wins, to show what can be accomplished when territorialism is overcome, set aside. And so it's up to us again. The onus is on us as data scientists to develop success exemplars of situations where we can demonstrate real wins. And in the case of overcoming that territorialism.
Thank you. Completely agree with all of that. And just to give maybe a specific example, in my experience, it's mostly governance rather than territorialism. Because, for example, if we have collected a data set, before we can collect the data set, we have to apply for approval. And we get those approvals for us to hold and analyze that data set. And then another team asks, can I have it? And it's not about territorialism, it's just we were not allowed. However, we and the other team could apply for further approvals for share that data. I'm not motivated to do it because it's not, I've just got too much on my plate already. If, however, making data available and sharing data was a professional goal or something that counted towards your professional development as papers or grants received do, then I would do it, because then actually it's not that I'm not motivated, but you see, I have to do things that bring in more grants or bring in more papers. I can't do things that don't count towards those current success metrics.
Yes. And actually, there's a specific question for you, actually, Charlotte, which is sort of from your perspective, how easy did you find it making the transition from a frontline clinical role to a role working your current role as commercial at Limbic, and what were some of the challenges to that?
Do we have anybody going through a transition now? Anyone who wants to? I guess it was challenging. Not going to lie, I was one of the very few doctors that decided to make the move into industry. It was seen as moving to the dark side. Anyone has ever heard that term before? Seen as giving up on your vocation. That you joined medicine because you had a higher goal of treating patients. And so now moving into a world where you are thinking about commercializing technology or commercializing anything to do with healthcare was almost, quote unquote evil. Like you were a bad person for moving into that space. And I think that was probably the hardest part of moving into industry. It was dealing with the moral backlash from my colleagues and friends who saw that perhaps maybe Charlotte was more interested in having, six-figure salary, a Lamborghini, trip to Barbados whenever she wants. By the way, that never happens. Consultants are not thinking that much. Certainly, like startups won't be able to think that much. So I think things are getting better. So the other day I was part of a panel around medics who are moving into industry, and we had about 400 people in that course. That would never have happened when I was FY2, trying to set up my own startup, trying to join some kind of networking event with similar like-minded medics who are moving into that space. I would have maybe been a handful, and we would have been quite coy, you know. So I think things have changed a lot, and you know, we can talk about the reasons why it was very hard back then, but I think it's getting easier.
Right. So I think that's really, really great to hear about that experience that you've had. And I think talking about our own personal experience is probably the most useful for the audience. Thanks very much. So there's a question for all speakers. What are the things and people that made you stay in the STEM funnel rather than the attrition? Why are you all still here?
Like a hot potato, isn't it? Yeah.
It has enabled a very rewarding career. As I mentioned when I first began speaking, when I was introducing myself, I wanted to be able to, I really wanted to be able to make a difference. I really wanted to be able to make meaningful contribution. And as I delved into academic research and teaching, and then also I've done a lot of industrial consulting work, I was seeing the evidence in my own life, in my own world, that basing decisions on data, making recommendations and improvements and fixes based on data produced really good outcomes. And I could see that that was having an impact, that it was having meaningful impact on the organizations or the projects that I was working on. And so I wanted more of that. And I wanted more of that. And years, months turned into years, turned into decades, and 30 years later, I can look back on a career of having had impact because of data and my ability to work with it and use it in productive ways. And that's why I'm still doing what I'm doing and hope to for many decades to come.
Even though earlier I kind of mentioned that I'm not of an academic descent, family-wise, we did live in a really good area with really good schools, which means I had really good friends, fellows. Because I also living close to your school meant that I had good access to after-school clubs, including science clubs, but also because I didn't have to take an hour's bus back to a further area, I could stay in the after-school club, I could hang out with the fellow nerds, we could write programs. So I was really privileged in the access to nerds. I should really do that. And that really helps. I'm very conscious that most people in the world, men or women, don't have that sort of access. And I guess it's how to bring maybe coding club, I say coding clubs, science clubs, coding clubs, STEM clubs to all the communities, and not just kind of central big-ish town girls.
Can you repeat the question?
Yeah, so I think just coming back to why are you still, I mean, I think we're talking about this attrition, that we see it, and you see it at various different stages. So why are women lost and men remain? And why do we end up with this 15%? So why are you guys in this 15% rather than doing something different?
I'm extremely introduced. Stay the course, and I will not do it. No, I think there's a huge responsibility that I feel when you're the only woman to have done something, or the only woman in a company, or you're seeing that there's huge impact in what you're able to do, and not yet at a stage where you have the responsibility or the responsibility to make the change that you want, so that you get more women in droves to be able to come through the door. And so I guess I put that pressure on myself from a very early stage. I was like, if I'm going to do this, I have to make it right. You know, I grew up in a world where Elizabeth Holmes, Serrano, did the total opposite. I need to do not that.
Yeah.
I need to show that we make it happen. I need to show that we like deliver really, really stuff, like huge impact in the health tech space. And I'm still working on that, by the way. I don't think I've gotten there yet. But yeah, I'm inspired each and every day by the incredible women that I meet on their journey. So that's why I'm still here.
Yeah, brilliant. I think it is inspiring to hear everybody's personal experiences. Should we have one?
I think we probably have time. Yeah, so there's a drinks reception afterwards, which I hope many of you can stay for. And I'm delighted to say all our panelists can stay for a bit as well. So we're not able, unfortunately, to answer all of the questions that you've asked today. But if people have additional questions, please come and find us during the reception afterwards and can answer some more of your questions. But I think we'll finish with one question, actually. So we've spoken a lot about what we can all do as women working in data, and also what we can do as mentors to help others aspiring to careers in health data. But what do you all feel that sort of those in more senior leadership positions could and should be doing to better enable women in health data science careers? I can give you a bit of time to think about that, because then it's quite a challenging question.
Well, I guess I feel like I answered part of that.
Yeah.
With, you know, the sort of things I want to try and introduce at Limbic. And I think on the flip side as well, I feel a responsibility as a woman to role model the kind of attributes, the character, the behavior, the values that I expect other women to have to be able to make it. So I push back. I am assertive. I'm very clear with what is okay and not okay in the workplace. Men or women will receive the sharp end of Charlotte if you get on my bad side. And it's all about integrity. It's about having clarity of vision, clarity of values, and ensuring that that is imparted to the organisation. So I think it's not a gender thing, but certainly from, you know, perspective of a woman who is in this unique position and calling bad behavior out and trying to role model good behavior as much as possible and owning up to mistakes. It's really key.
Thank you, Lauren. Does anyone have anything to add to that? And sort of what should we be asking of our senior leadership, and what can they do to enable women in health data science?
It's related, just following on what Charlotte said, it's my understanding that forcing people who have these basic understandings of culture and workplace onto diversity training does not work. The only thing that works is for the woke ones, and I assume this room is a selected group in that. The only thing that works is for us to verbalize disagreement with old, dated, unnecessary systems and opinions that don't support diversity at workplace. We just need to be vocal about it. It's not enough to quietly disagree with someone. Unfortunately, I know a lot of people want to avoid conflict, which is understandable, but we cannot make this huge shift from 15% diversity to 50% with avoiding conflict, which is kind of
Well, I'm a big advocate of lifelong learning. And so when we talk about senior leadership, they don't have all the answers. We don't have all the answers as senior leaders.
And so I think one of the things that we need to do for senior leadership as an institution is enable them to continue learning. And that means that that they probably need to refine and retune their leadership skills as their careers progress. And I think that that's something that can and should happen, even at the executive level of organization. And by retuning and refining, I mean being on the cutting edge of inclusion and ensuring that they're building diverse teams and ensuring that their leadership reflects the values of today's organization.
Thank you, Julie. So I have to apologise that we haven't had a chance to answer everybody's questions, and I think there's still lots more absolutely amazing questions in the chat. But I'd really encourage you all to stay after this panel if you can, and come and find us and to ask your specific questions. And I certainly feel very inspired to continue my career in health data and to seek other like-minded women working in health data, and both women and male allies who can help me to further my ambitions. But I think now I'm going to hand back to Aziz, who's going to make some closing comments before we go for the break. Yeah. Yeah.
Thank you, that's brilliant. Breaking glass ceilings. I think what I'm really So thank you so much, really. Thank you. And I mean, it was really very
Thank you.
Finally, I just wanted to flag the next event in our series. And that will be coming out on the 3rd of November, and it's preventing babies from another disease. That will be about but again, finally thank our panelists